Today we're going to go over the bones of the appendicular skeleton. First off, we're going to start off with the clavicle. This is the right clavicle. This is the sternal end of the clavicle, and this is the acromial end of the clavicle. Next bone we're going to go over is the scapula. This right here is the lateral border, and this right here is the medial border. This is the right scapula. The top right here is the supraspinous fossa. This is the infraspinous fossa, and this here in the back is a subscapular fossa. Another fossa is the glenoid fossa or glenoid cavity. This right here is the superior border, and the superior angle is right here. The inferior angle is at the bottom of it, and on this side is the spine. There are 2 points on it, or processes. This is the coracoid process, and this is the Bromian process. And the next one we're going to go over is the humerus. This is the right humerus, by the way. Right here we have the head of the humerus, and then we have the anatomical neck, which goes around the head pretty much. This is the lesser tubercle right here, the greater tubercle right here, and then we have the surgical neck that goes around this. The deltoid tuberosity goes around the back right here, pretty much right here. Then we have the medial epicondyle far right here, and then the lateral epicondyle. On this side we have the trochlea, and on the right side we have the capitulum. Then we have this hole right here, which is the coronoid fossa, and the other hole beside it is the radial fossa. And then on the back we have this big hole, which is the olecranon fossa. And the next one we're going to go over is the radius. This is the right radius, by the way. This right here is the head of the radius. The neck goes around right here, and then the radial tuberosity is this part right here. And then we have the stylar process, which is this pointy part right here at the end. And the next one we have is the ulna, which is a right ulna, by the way. Right here we have the trochlear notch, and then we have the coronoid process and the olecranon process, which is on the proximal end. And on this side we have the radial notch, and then we have the head of the ulna, and the stylar process is this pointy thing right here towards the distal end. The next we're going to do the parts of the hand. This right here is the scaphoid. This right here is the lunate. This right here is the pisiform, which is on top of the triquetral. And then we have the hamate, which kind of bulges out because it has this pointy part at it. And then we have the biggest one, which is the capitate. The one next to it on the top is the trapezoid, and then the trapezium, which is connected to the thumb. We have a loose scaphoid right here, a loose pisiform, which is pretty small, and then we have the hamate, where you can actually see the pointy part which sticks out. The digits are named numbered laterally to medially, which means that the thumb is number 1, and then it goes 2, 3, 4, and 5. These right here are the metacarpals, the first ones. and then from there we have the phalanges. The thumb only has a proximal and a distal phalange. It doesn't have a middle phalange, such as the pinky, which you can actually see all three of them. The proximal, the middle, and the distal. And this is a right hand. The next one we're going to go over is the pubic bone. This is the iliac crest. This is the anterior superior iliac spine. Anterior inferior iliac spine. And then on the back right here we have the posterior superior iliac spine, posterior inferior iliac spine, and then we have the iliac fossa, and we have the greater sciatic notch, the lesser sciatic notch, the obturator foramen, the inferior ramus, the ischial ramus, the ischial tuberosity, the superior ramus, the pubic symphysis, and the acetabellum right here. And this is a right pubic bone. And the ischial spines right here. The next one we're going to go over is the femur. This is the right femur, by the way. This right here is the head of the femur. And around here we have the neck of the femur. And then we have the intertrochanteric line. On the back we have the greater trochanter and the lesser trochanter right here. And right here across them both is the intertrochanteric crest. We have the gluteal tuberosity right here in the back, which is kind of rough. And then we have the lineal aspera right here going across down it. And then we have the intercondylar fossa, and the patellar surface, which is in the anterior part of it, is right here. And then we have the lateral epicondyle and the medial epicondyle. And then we have the medial epicondyle, medial condyle, my bad, and the lateral condyle. Also, we have a right patella. There's one way of finding out whether it's a right or a left. First of all, this is the base of the patella, and this is the apex of the patella, which is kind of arrow-shaped. You face the apex away from you, and you lay it on the ground, on the table, wherever. And whichever way it faces is what it is, and it faces to the right, so it's the right patella. The next one we have is the tibia. This is the right tibia, by the way. First of all, we have the lateral condyle, the medial condyle. We have the anterior crest right here, the tibial tuberosity, and the medial malleolus right here. Oh, and also we have the intercondylar eminence, which is the pointy part right here, which sticks out. Next we have the fibula. The head of the fibula is right here, and then we have the neck going around it right here, and then we have the shaft, which is this thing, and the lateral malleolus, which is the pointy part of the fibula. Next we have a foot, which is a right foot. We have the biggest bone of it, which is the calcaneus. And then we have the talus and the navicular, which is connected to the talus. And then we have the cuboid, which is connected to the calcaneus. And then we have the cuneiforms right here. There are three of them. We actually have a loose calcaneus, a loose talus, which is pretty small, and then we have a loose navicular. The digits are numbered medial to lateral, with the big toe being number 1, 2, 3, 4, and 5. In the metacarpals, this is the base of the metacarpal, and this is the head of the metacarpal. The big toe only has a proximal and a distal phalanx, whereas the rest of them have a proximal, a middle, and a distal phalanx. And that's it for that. And that concludes the video of the appendicular